Happy Monday, everybody. I hope the weekend was good. I got a lot of calls about the Hank Greenberg documentary. I'm glad you like it. This week, as per requests, I have It's a Mad, 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 Mad World tonight. Blazing Saddles tomorrow night. Listen, Blazing Saddles has a lot of offensive language, so if it's going to bother you, don't watch it. The Met is back. We're doing West Side Story. I know that we've tried to show that a few times, and it's been messed up, but I think it's okay now. I don't know what the musical is Friday night yet. It hasn't been announced. I have a Rodgers and Hammerstein program on Saturday night, which is very good. And you have the schedule. Please keep calling with suggestions and requests, because it's the only way I know what you want. We are working on trying to get some live programming going, and that's just requiring a little bit of technical stuff. And I think I figured out a way, with the help of our community in Boca Raton. So I'm working on it. We'll see. Masks. Okay, as you know, I'm in the art room. This is where we record from. There are way too many of you sitting out there without masks, not 6 feet apart. Why? Why? We do not want another case in this building. We have been really good since June, and most of you have been listening, but please, just stay 6 feet apart or put the mask on. We don't want anyone else sick. Certainly don't want anyone else passing away from this. It's really just been a tough 5 months for all of us. So please, masks. And, you know, this routine doesn't work, or this. I can't even do it because of my glasses. Nose and mouth. Then you're covered. And I know it's hot. Oh, and by the way, the air quality and heat index is really bad for today and tomorrow, but I do see you're all still sitting out there. Please bring water when you come out. And that's it. For me criticizing you. Okay, so a couple things. First, we now have 4.2 million cases of COVID in the United States. Almost 147,000 dead. We will be over 147 today. This is as of yesterday's. The hotspots: Louisiana, Mississippi, Alabama, Nevada, Tennessee, Georgia, Arkansas, California still, Florida, Texas, South Carolina. These are all states that opened too early. And and the National Security Advisor, Robert O'Brien, was tested positive for COVID. But they say, oh, he's symptomatic and he wasn't near anybody. Well, he's been in pictures for the past 3-4 weeks with the president and the vice president. So that's a little concerning. And who knows who he's been around in the White House. But every time anyone tests positive, they claim they weren't with anybody. Well, and then we see pictures. They can't even tell the truth about that. It's a very simple thing. Now, what's most concerning about the COVID cases in the United States is how bad we are compared to the other developed and developing countries. Okay? The only people better than us are Brazil. The only country. That's really bad English. Okay. We now have 60,000 new cases per day on average. It's actually over 60, but so we have 20 people per 100,000 have contracted this virus. Now, again, these are the people that have been tested. We know it's actually more people. Only Brazil is better than us. They have 22 per day. Meanwhile, 22 per 100,000 people. They've got 45,000 a day. Meanwhile, our northern and southern neighbors have done a much better job than us. Canada currently has approximately 500 cases per day, and their total case count has been 1.4 people per 100,000. Mexico, they're ringing in about 6,600 new cases a day, but total is 5.2 cases per 100,000 people. So now, in the case of those two countries, there's no mask issue and there's no political protest over this. And they've quarantined and they've done a good job testing. I mean, Mexico should not be in better shape than we are. And in anything medical, they don't have the facilities, they don't have the money we have, but they are. And it's not getting better. It's not getting better because now it looks like Texas is going to have to close down again, probably Florida. But you've got politicians there that are not willing to do that, and so the cases keep growing. I want to talk about the vaccine that they're all talking about, but first I want to just talk about a couple other things. The protests in Portland. So the president sent in federal agents with no identification, so it doesn't say U.S. Army tyranny on it, nothing. And they are picking up people on the streets. We don't know where they're taking them. They are tear gassing and shooting rubber bullets. They tear gassed the mayor of Portland and other officials who were with the Black Lives Matter protests. The states and cities do not want them there. They are causing the violence. They are instigating what they're calling rioting. Now, why are they doing this? Why? Well, it's actually really simple. They're doing it so that they have commercials to be made. They can have actual footage. So I did like they actually used a picture of a protest from the Ukraine saying this is what was going on in our cities. There's a picture of protesters beating up a police officer, but it wasn't from America. The campaign used a stock photo from the Ukraine. So I guess they're actually looking for American pictures like that. So they're creating a situation where that will happen. So it is absolutely 100% politics. There's been no violence in Portland until the federal agents showed up. Now they're in Seattle and Oakland, and what's happening? The violence is rising. They are instigating this. It is totally unacceptable. And they are doing it so they can go to their base and say, oh, look at the violence caused by the protesters. Look what happens. This is just playing to the racist, white supremacist base. No one else. It does not expand his base. It does not expand his electoral map. It makes absolutely no political sense why you would do that. Because it doesn't, to me, I see things like that and I say, well, the federal agents are there and then all this is going on, so the federal government can't control these situations. They seem to think that they can then blame the Democrats and Joe Biden or something for it. Now, the other thing is they're absolutely insistent that schools open in some cases about a month from now, depending. Some states open earlier than us. But they've canceled the Republican National Convention, the group events in Jacksonville. So it's not okay to hold a convention, which, by the way, is in one place, and you probably could control it in some way with social distancing and masks and sanitation. They can't have that, but they want the schools to be open. How do you do that? What little kid is going to socially distance. They don't know what that is. And when asked for a plan, then they say, oh, the states have to figure that out. That's not a plan. As usual, we don't have a plan from the federal government. Now, on the Democratic side, we still don't have a vice presidential pick. Politico was reporting that basically nobody knows what former Vice President Joe Biden is thinking. They are vetting people. They're looking for someone who does no harm. And they also are concerned about someone with foreign policy experience. So while the vice president is partial to senators because he had spent so much time in the Senate, the senators who seems to be in the running right now really don't have a lot of foreign policy experience. So that's why you're hearing Susan Rice's name being floated around now, because she certainly has that. I don't know that that's a good idea, because I think that gives the Republicans the window to start talking about Benghazi again. And I, for one, have had it with that. So I don't ever want to hear the word Benghazi ever again in my life. And I'm sure you don't either. So, because she was involved in the public press on that when those protests in Libya started, which led to Benghazi. So I just think that opens that whole can of worms up again. And we know that their people believe whatever they say, so truth won't matter. And I don't know that she really helps with the undecided or independents. I don't see how she brings anything. Though, if the choice is about doing no harm, if the candidate that you want to pick as vice president does no harm, other than Benghazi, she doesn't do any harm. I mean, I'm still rooting for Kamala Harris. But there's all this grumbling that they don't think she's a team player. So I don't know if that's coming from other wannabe vice presidential picks, or if it's coming from the Biden people or someone else, and I don't know. The Sanders people have started nonsense again. They, some of his delegates are demanding that the platform include a promise for a single-payer healthcare system or Medicare for all. No. The Biden people cannot give in on that. All right. That is a no-win situation for the Democrats right now. Now, I've said to you before, I believe at some point we will have a single-payer system in America. But too many people oppose that right now, and I don't think that should be the number one issue on our platform. And if that becomes a platform policy, that gives them ammunition. It's just, this year is just no ammunition. Give them nothing. And I know the Sanders people are zealots, but it has to stop. And Joe's got to call Bernie and say, this has to stop. Someone's got to call him. There can be nothing controversial in that platform, nothing controversial happening wherever they're holding the events, nothing. It just, this campaign has got to be about Donald Trump. If it becomes about all those other things, he can win. If it stays about Trump, Joe wins. So, and I'm going to go through some of the numbers because they are very encouraging right now. But first, I want to talk about something that I am actually legitimately afraid of. The Wall Street Journal and other newspapers, but I read the Wall Street Journal article, is talking about Moderna and Johnson & Johnson developing vaccines. And they are claiming that Moderna, right? Moderna, however, I don't know how they pronounce it, doesn't matter, is in final stage testing of a COVID vaccine. And I don't believe that's possible. Okay, now, so I went looking up what you have to do to get a vaccine approved. Well, and actually not even just approved, just what you have to do to make sure a vaccine works. So, and I looked up the history of vaccines. So I'm just going to go through this with you. Chickenpox. The first vaccine was created in 1984. It was not approved in the United States until 1995, 11 years. Measles, 1963 was the first one. And then 1971, Merck created the MMR, the measles, mumps, rubella. And so that was, 8 years. Polio, the first test was 1935. Jonas Salk was testing and still doing final stages in 1952, and we didn't have a full, completely approved polio vaccine till 1961. So it's 17 years. The flu, years and years they tried to develop a flu vaccine. That went on for like 25 years. The current flu vaccine that we take was 2012. The one we had been using before had been from 1995. So 14 years? 17 years. Hepatitis, 1971. The first vaccine was created. The FDA didn't approve the final stage testing until 1981, and we didn't have the new version until 1986. So 10 years between creation and FDA approval, and another 5 for the perfected version. Meningitis, 7 years in development, from 1974 to 1981. So now here's the COVID-19 virus that we didn't even discover till 7 months ago, and they're saying they're in final stage testing. That is not possible. So I'm going to go through with you the stages of vaccine development and testing. Okay, this is after you identify the virus or the disease, and I'm not a scientist, but this is after we know what it is, what it does. Okay, so the first thing is you're doing basic lab research, which for any vaccine, according to the CDC, is 2 to 4 years. 2 to 4 years. Then you do a preclinical study, or studies. And what that involves is using tissue culture or cell cultures, animal testing. This assesses the safety of the vaccine and its ability to provoke an immune response. A lot of times the animals are mice, monkeys, and sometimes pigs now because they have the same kind of nervous system we do. This gives researchers an idea of the cellular responses they'll expect in humans. Okay, they then start safe testing how to give the vaccine, whether it's oral, whether it's a shot. Okay, so most vaccines never go beyond that point because they say it fails to produce the desired immune response, most of initial vaccine trials. This preclinical stage lasts 1 to 2 years. All right, so if it passes the preclinical, then the manufacturer, who usually, by the way, is working with the government agencies, they have to apply for what's called an IND. That is an investigational new drug to the FDA. A review board approves the protocol, and the FDA has 30 days to approve the application. Now, once that's approved, there's 3 phases of testing. One is vaccine trials. They'll assess the candidate vaccine in humans involving a small group of adults, usually under 100. If it's a vaccine for children, they test adults first and then slowly go down. In this case, it would be adults. This tests the safety of the vaccine and determines the type and the extent of the immune response that the vaccine provokes. Okay. In a lot of these trials, they will give you the vaccine, and then they will actually give you the disease to see how it progresses. Now, with a disease like COVID, and I read this actually on Merck's website, which is similar in duration as the flu, a non-lethal version of COVID lasts as long as the flu. Now, we know that's not true for everyone, but it is. So basically in the phase 1, if I were to volunteer to be in this, I would be given the vaccine. I would then be given COVID. And then we would wait. So we would wait 14 days to see when I got symptoms, if I got symptoms. Now, if I didn't get symptoms, great. But if I did, then they would go back, increase the dose. So this is a progressive test. All right. So assume that works. Now we're in phase 2. This goes to hundreds of people involved. It is also when you pull in people that are in high-risk groups. And you do the same thing as you did in the phase 1 trials, except it's with higher risk groups, and you test the, you also have a placebo group, and you're still testing the safety, testing the schedule, and the method of delivery. Then you go to phase 3. This involves thousands and thousands of people. They are randomized and blind, and they also have a placebo group. This assesses the vaccine safety in large groups of people. Okay, so the bottom line is, does the vaccine prevent disease? Does it prevent infection? And does it lead to a production of antibodies so that you don't get it again? All right, so you pass all that. Then you have approval and licensure. So the FDA has to approve that. The FDA, before they approve, they have to go and inspect the factory where the vaccine is going to be made and approve the labeling. Then they monitor their production, and they go back and forth to the facilities, and they test the different lots. Okay? Then they approve a license. Now, you see where I'm going with this? This is a long process. Then they go to phase 4 trials. This is still to prevent safety. Then they have to create a list of adverse event reporting. All right, so those are side effects. So they need, how many people are involved in this? They have to have 30,000, and they have to report anything over 1%. So they have to detect new, unusual, or rare vaccine adverse events. They have to monitor any increase in those events, side effects. They have to identify patient risk factors for those, check vaccine lots against those with any adverse effects, And only then, after all of that, and that process, by the way, is supposed to be 6 months long initially, and then the FDA will say if there are adverse effects or side effects for, say, a specific group of people, or a certain age, or certain lots, or certain dosages, then they have to track them again. Only then is it approved, any vaccine, for mass use. So we have a virus that was identified in December of 2019. And they are telling us that 2 companies, well, Moderna is in the final stage testing, and Johnson & Johnson says they'll be in final stage testing by the end of the year. How is that possible? It's not. Okay, so this is another political move. You will see they will rush and they will approve this vaccine. They do not have the side effects studies done. This isn't even enough time for phase 3. And they're going to run around and say we have a vaccine. I am not taking that vaccine. And I would tell all of you, or anybody, to not take that vaccine. I am not an anti-vaxxer. I take the flu shot. I support vaccinations, but not this. And that's why I went and looked up the history of these other vaccines. You're talking about years and years in development. This is months. Months. Where are they doing these tests? Who's approving the stages? Where's the FDA? Why is CDC and NIH not involved? Why are we hearing about this from the pharmaceutical companies and from the White House? Nobody else. Nobody else. So this is very worrisome to me, and I can promise you that I'm not taking that vaccine. So until it has been on the market for a while. And I suspect that any sane people in America will not be taking that vaccine. I'm not a scientist, but I looked at history. Now, obviously, we have a little bit better technology now than when we created some of these vaccines, but there is no way that you can test any even short-term serious side effects in this amount of time. There just is no way. So this is really worrying me, and when elected officials are standing up and saying, oh, this vaccine's coming like it's magic, and we're just going to give it out, that's insane. So, which leads us to the election. There are some really, really encouraging numbers out there right now. We have 100 days, actually 99 as of today. All right, so I'm looking at the maps, and I know you've heard all of it, but I'm not as pie in the sky as everybody else is, and I hear some of them on TV talking about some states that I absolutely don't believe Biden's going to win, or Trump will lose, really. But the path to victory, and getting this man out of the White House, which I don't care about anything else, as you know. This is the only thing. He has to go. Now, former Vice President Biden is leading in almost every swing state, and actually is doing really well in states that he shouldn't be, like Texas, right now, Texas polling has Biden and Trump even, dead even, with 10% undecided though. So that's that's where I worry about this race to a vaccine, because I think that's the October surprise, by the way. They're going to say, look, there's a vaccine, and think that will swing some people to them, and then we'll find out that the cure was worse than the disease afterwards. So though they are even in Texas, which is amazing, there are 10% undecided there. Now, the thing is, even with 10% undecided, that forces the Trump people to have to spend money in a state that they really should not spend a lot of money in, but they have to. Arizona, running even, but only 4% are undecided there at this point. And there's a Senate race there, a competitive Senate race. Martha McSally, Mark Kelly, Gabby Gifford's husband, the astronaut, he's running as the Democrat against incumbent Martha McSally, who was appointed to the position. She lost the Senate race to Kyrsten Sinema, and then what happened was the Republican governor appointed her to fill McCain's seat, if I'm remembering correctly. Lots of Arizonans were mad about that because they had already rejected her. They didn't want her, but now she's in the Senate. Well, Mark Kelly is up there 12 points. That's a big lead for a Senate race at this point in time. And meanwhile, and combine that with the fact that Biden and Trump are running evenly with only 4% undecided there. I mean, I think this is a case where the Senate race will pull out Democrats who will then vote for Biden. You're not going to have crossover there. So, so that could be a win for Joe Biden. Florida, he is up, depending on the poll, and all these poll numbers, I always look at Fox's, and I look at another one, NBC, New York Times, a few of them, Wall Street Journal has them, because sometimes if it's not consistent, I don't look at it. I don't count it. If you have three polls that are in the same state or same place that are wildly different, no. So these are all consistent polling numbers. Florida, the Vice President Joe Biden is up 5 to 7%. There were 4 polls, 2 at 5, 2 at 7. Now there is a margin of error there, so let's say 5. But only 3% are undecided. So what you're seeing is in those states, people have made up their minds. Now, not true for a couple of them, and I'm concerned about these. Ohio, dead even, pretty much, but 9% are undecided. That's a lot. Pennsylvania, Vice President Biden is up 11 points there, pretty consistently, but 11% are undecided. Now, the chances of all those votes going to one candidate is not realistic, is not going to happen, but I don't like that number. Michigan, Biden is up 12 percentage points. Wisconsin, weird. Vice President Biden is up by 11 with 13% undecided. Now, North Carolina, which should not be in play, Biden is up by 7% with 5% undecided. So these are unbelievably encouraging numbers if you are Joe Biden. They are horrible numbers if you are the Trumpians. There isn't a lot. And Georgia, which I don't think Biden will win, but Georgia, they are running even. That shouldn't be happening. North Carolina has been slowly but surely turning Democrat over the years, and it's always disappointing to the Democrats when we don't win North Carolina. But that really is truly a swing state right now. Senate race, and what's happening there is you got Thom Tillis, the current senator. The Democrat is up by 10% there. So that is also another state where the Senate race could actually bring out more Democrats and help Biden. But again, there's a state that they shouldn't have to spend lots of money on in a presidential year, and they're going to have to. So when you add these up, I mean, when you look at what I believe at this point Biden will absolutely win. Mrs. Clinton received 232 electoral votes. I believe that Biden is already at 248. Because I think that he's going to win Michigan. There's my 16, right? Yeah. I think Michigan is done. So he only has to win. I mean, if he picks up Florida, it's over. And that'll be early because that's East Coast. If he wins Florida, it's done. If he wins North Carolina, it's almost done. So these are really horrible numbers for the Republicans. Excuse me. And they're particularly bad for them given the state of the Senate races. Because right now, the Democrats need 4 seats in the Senate to take over the Senate. The House is really not in play. The Democrats will hold that. But, okay, so where are the 4 Senate seats? Arizona's 1, Mark Kelly. Colorado, former Governor Hickenlooper, he's up 11 points against Cory Gardner. There's 2. Maine, Susan Collins is down at least 5 points. Some have her down much more than that. There's 3. Now, here's the thing about those. In North Carolina, Thom Tillis is down 10. All right, so here's what happens election night. You have Maine and North Carolina called early. And then the other places that we want, Arizona, Colorado, and Iowa. Those come later. Now, at that point, you're watching TV, those polls are still open. And what you're going to hear is Biden's winning this. Here we got a flip on the Senate seat. You know, who then goes out to vote? Not the Republicans. Democrats go out because that's what the Democratic Party people will be waiting for. And then you start getting people to the polls. Now, the one that I am interested in, because the president has screwed this up. What is he up by? All right, the Alabama Senate race. Now, right now we have Doug Jones, so we could lose that one. And then we're at 50-50, which would still be okay if Biden wins the presidency. But if he doesn't, then it's not good. But I don't want to think that. Okay, Alabama, we got Doug Jones in there now, which he won in the fluke. If you remember Roy Moore, the guy who was the Republican candidate when Jones won, he had been, picking up teenagers and he had all these sex scandals. Okay, so Jeff Sessions ran. He had been the senator from Alabama. He ran. The president campaigned against him. So this guy, Tommy Tuberville, that is his name, won. He's up right now by like 16 points. I am really, really hoping, and I heard a rumor about this the other day, I am really hoping that Jeff Sessions can be talked into running as a third-party candidate, just to get back at Trump. Because if he does, we could hold that seat. Because no Democrat's going to vote for Sessions, and no Democrat's going to vote for Tuberville. But the Republicans will split their votes. And there are a lot of mainstream Alabama Republicans are really mad at what Trump did to Sessions. So he's a He's a well-liked man, Jeff Sessions. I've told you before, he's not very bright, but he's a very nice man. So I'm really hoping somebody talks him into getting his name on that ballot. He's got time. And that could do it. Now, if we don't win, if we win Arizona, Colorado, Maine, and North Carolina, but we lose Alabama, it's 50-50. So that makes Iowa critical. And I think it is going to be Iowa that decides who wins the Senate. And that's Joni Ernst. She's a nut. And I will be very happy on election night when Susan Collins loses, by the way. And I've told you before, there's a special place in hell waiting for Susan Collins. And I hope that that's what happens in November. So that's where we are. I think that right now we're in great shape to get Trump out of the White House, as long as nobody messes it up, as long as no wrenches are thrown in. So the Sanders people need to just bite their tongues and be quiet. If they don't act up, they're going to have a seat at the table. We already know that about Joe. They're going to have a seat at the table. And you would think they would have learned from last time. The other good thing about this year versus last election is we have no real third-party candidates. Nobody with any power. I mean, there's a Green Party candidate, there's a Libertarian, whatever, but nobody with any stature. And I do think the liberals did learn from last time that throwing away your vote and then we end up with Trump again doesn't work. And I think that the Republicans against Trump, who have been totally out of the closet now and public, they also have learned that voting for Gary Johnson last time didn't help, and they're biting their tongues. They're holding their nose, but they're voting for Biden. So that's the good news. So have a great night. I will see you soon. Call me if there's something. Somebody called me, by the way, and asked me to talk about something, and I wrote it down, and I couldn't find my note today. So now I can't remember who it was. But if you call me and tell me what you want me to talk about, if there's something you want me to specifically address, please do it, and I'll bring it up next Monday. Thanks. Bye.